Chocolate cyst. Most of the females are common with this terminology. Most of the actresses have got this chocolate cyst. The symptoms of chocolate cyst are pain during menses, that is called dysmenorrhea, and the pain during intercourse, that is called as dyspareunia. There are different causes. I'm not going into the details. How to approach a patient of a chocolate cyst, which we call as endometriosis in our technical language. First things first, do we need to go for a laparoscopy in each and every case of chocolate cyst? Answer is no. Then how do we approach a case of chocolate cyst? My first and foremost thing is if husband count is normal, if her female's hormonal investigations are normal, and if her fallopian tubes are patent on HS-graphy, we would give a trial for about 3 to 6 months, provided the size of chocolate cyst is less than 3 cm on ultrasound. After a trial of 3 to 6 months, if she does not conceive, then probably we would go for a laparoscopy. On laparoscopy, depending upon how severity the endometriosis is, we would go for the further management, whether a controlled ovarian hyperstimulation followed by IUI or directly for IVF. But the take home message is you don't need an laparoscopy in each and every patient of endometriosis. Secondly, I have about 2 patients who have conceived naturally with my treatment. Thirdly, the chances of IVF are pretty much high in endometriosis. If we go for a laparoscopy, it is better to go for an IVF immediately after laparoscopy to increase the chances of pregnancy in a patient of an endometriosis or a chocolate cyst. Intrauterine insemination. It is again one of the most frequently asked questions. Most of the patients directly give me a call, sir, do you do IUI? What are the chances of success of IUI? How is it done? Whether my sperms would be used or not? What are the chances of success? Now we have to know one thing for sure, that it is like a medicated intercourse. I means intra, U means uterine, I means insemination. That means we are taking the sperms out of the male, processing it in a machine, separate the sperms and the seminal fluid, take the good quality motile sperms and directly deposit in the uterus of the female. That is intrauterine insemination. Now it is not a magic procedure. What I call in my language, it is basically a medicated intercourse. Whatever the female and male is having an intercourse, during a normal intercourse, the male is ejaculating the sperms inside the vagina, while during IUI, we are directly putting those prepared sperms into the uterus of the female. Does it have a 100% success rate? No. A normal pregnancy occurs in about 70 to 8% of cases during per month. During an IUI, that chances can be increased by about 2 to 4%. Now there are different methods of doing an IUI, different ways to increase the success of IUI. That depends upon case to case. Say we do a controlled ovarian hyperstimulation, we give the gonadotropin injections to increase the number of follicles. If we increase the number of follicles, the chances of pregnancy increases according to the number of follicles. Say there is a 1 follicle and we do an IUI, the chances of pregnancy per cycle is about 10%. If there are 2 follicles, we combine it with IUI, the chances are about 14%. If we do an IUI with 3 follicles, then the chances are about 15 to 20%. But IUI cannot give it more than 25% chances in pregnancy. If there are more than 3 follicles, then we don't do an IUI in that cycle. Now when we do an IUI, if the husband's semen is normal, we do IUI in unexplained infertility, in which apparently everything is normal but female is not conceiving. What happens? People come to me and say the husband counts are very less or probably they are 0. In that way, either we do IUI with a differential centrifugation method, or if the counts are 0 and if the couple is willing, then we give them an option of a donor insemination, in which we take the semen sample of an unknown donor. Donor does not know that who he is giving sample to, and the recipient does not know whose sample is it. That's called as an artificial insemination donor. But again, the chances of success varies in an IUI. It is not a be all and all kind of thing. I mean, it is not a 100% success rate. But having tried normally for about 12 to 18 months, if the couple are not conceiving, then probably we do an IUI to increase the chances of success. But doing a plain IUI without an ovulation stimulation, without a controlled ovarian hyperstimulation does not help. Ideally, we have to give a good, decent controlled ovarian hyperstimulation with a good laboratory setup and then do an IUI. Then and only it will help. Patients come to me with zero sperm count and they want to tell me that I want with my own sperm only. In that case, what we have to do is we have to test the blood of that male. If that male suggests that FSH hormone is normal, then chances are that that male is producing sperms in the testis. There might be an obstructive azoospermia, and in that cases we go for a TESA or a MESA kind of thing, or a testicular sperm extraction or a testicular biopsy, and then we can do an IVF with that kind of thing. If sperm count is zero but the FSH is normal, then there is no way in which that couple can conceive spontaneously. We have to take sperms out of that male, get it fertilized by that egg of female or the partner, and then we have to transfer that embryo inside. So this is about IUI. This is the most common question again. It depends. What did you get an IUI done for? If IUI was done for an absent sperm count in the male partner, then probably yes, you may have to get it done again. But if it was done for an unexplained infertility, there are good chances that you may conceive on your own. So infertility treatment is not like a black and white. There are definitely gray zones. We have to deal on an individual case-to-case basis, on an individual patient-to-patient basis. Same thing applies. If the patient conceived with an IVF last time, does she need to go for an IVF again? The answer would be again, what was the condition which we got an IVF done for? If IVF was done for a low egg in her ovaries, or if it was done for a zero sperm in the male factor, then probably she may have to go done again. But I have seen few patients who have got IVF done in the previous pregnancy and they have conceived naturally. See, the conception in first pregnancy is pretty much difficult. The couple is under stress. They are basically living in a dark room which we don't know whether there is a light at the end of tunnel or not. Once they conceive, they deliver, their stress levels are down, and believe me, second pregnancy comes very, very easily. So this is a case of a patient being patient. So if the patients have a good amount of patience, that they can conceive normally. See, the book says if a IUI has to have an effect or a IUI has to be successful, then the results are maximum within first 3 to 4 cycles. In donor sperm cycles, we do IUI maximum 6 times. If we don't get a result in 3 to 4 cycles, then there is no point, no fun of repeating IUI just for the sake of doing it. I tell my patients one cycle IUI cost is about 10 to 15,000 rupees, including the medicines, including the injections, including the procedure. You do an IUI for 6 cycles, you would have spent about 70 to 80,000 bucks, and this does not include the days you missed at your job. So the cumulative expense would be around 1 lakh. I don't want my patient to undergo that much cycles of depression, the failure, 6 cycles. So I tell them very clearly, we do IUI 3 cycles, we do IUI every alternate month. The per cycle chances would be explained to them very clearly. But even during those 3 cycles, if I find that my results are not satisfactory, we may abort the procedure before and we may directly tell them to go for an IVF. A good IVF done has got a better chances of success rather than doing IUI again and again, which it doesn't help. So the take home message is, please try IUI only for 3 to 4 times max or 6 times maximum in a donor cycle. Don't conceive. Please go for an IVF straight away. It would save time, it would save your energy, and the best part is it would save your money.
Thank you for watching this new health video on Iron Doctor, and we would be so happy to welcome you into our community. If you like this video, please press the thumbs up button, share, subscribe, and press the bell icon for regular updates. We regularly post on Wednesdays and Fridays, so if you're looking for the previous video, please press the top video. If you're looking for a random video on our playlist, please press the bottom video.